All right, so what is diabetic ketoacidosis, DKA? So DKA is the absence or inadequate amount of insulin resulting in abnormal metabolism of carbohydrates, proteins, and fats, right? So this happens in type 1 diabetes, right? So what we say that insulin is not allowing glucose to get inside the cell. So the body says we need something for energy. So what the body does, the body starts breaking down fats. All right, so due to the ketones, which are acids, start to enter into the body, and this can cause life-threatening situations such as acid and bases imbalances. So let's dig into DKA. All right, so what puts a patient at risk for DKA? Ages 13 to 25, females, if they had DKA before, physical stress on the body, which is energy, illness, infection, and surgery. Why do we think physical stress on the body would put a patient in DKA? Because the body now needs more energy to keep up with the physical stress on the body, right? So it just says, hey, we need energy. We just gonna start burning fats, right? New onset of diabetes, drug use, non-compliant with their insulin therapy, and certain medications can put you into DKA. So complications, metabolic acidosis. Metabolic acidosis for people who have DKA, dehydration, loss of electrolytes, cardiac arrhythmias. So decreased perfusion to the kidney. So we're going to talk about some of this later on. All right, so how is a patient going to present if they are in DKA? So they're going to have a decreased level of consciousness. This patient is going to be very fatigued, lethargic, and they even could be in a coma. Patient nausea and vomiting, abdominal pain. They will have a fruity breath from that body breaking down those ketones, right? Hyperventilation, Keys-Moll's respirations. Why? Because they're trying to breathe off some of that acid with deep breaths. Hypotension, arrhythmia, blurred visions. They're going to be super thirsty, right? So, and also weight loss, right? So we want to make sure that you teach your patient the signs and symptoms of DKA. All right, so that was just a quick overview because why? You guys understand the basics of it, right? You understand diabetes, so you understand DKA now. All right, so DKA, what are you going to do? So hydrate the patient with fluids, right? IV continuous infusion of regular insulin. So regular insulin, remember, is the only insulin that can be given IV. And when a patient is getting regular insulin, they're 9 times out of 10, they're in the ICU. Because you're going to need to be frequently checking their blood sugar. Then you want to reverse acidosis and restore electrolyte imbalances. So note, rehydration leads to increased plasma volume and decreased potassium. Insulin enhances the movement of potassium from the extracellular fluid into the cells. So guess what may be going up? Your potassium can go up. So anytime when a patient is in DKA, you want to be looking at their potassium level. You want to monitor their blood glucose, their renal function, their urine output. Looking at their electrolytes, they may need an EKG done as well to look at how their heart now is functioning. Lung assessments, right, due to fluid overload. So you just want to remember. So type 1 diabetics, blood sugar could be 250 to 800. When you have DKA, I mean, the highest blood sugar I saw a patient was in DKA, and I never forget her because she came in all the time. And I was like, girl, why you just won't get your blood sugar right? Why you keep on doing this? Because she was young. And I'm like, girl, what you got going on? And she was like, yeah, she just was very non-compliant. But with her DKA, she would be like at 790 something. And she would be alert and oriented with her. She would be fully awake in the ICU. And then she would transfer on the floor. And she was like, I was like, you just been here last month for this. So, fruity breath, cause more respiration, ketones in the urine. So we talked about ketones, why ketones would be in the urine, right? Because the kidney then starts to try to filter out all this stuff, right? And then it starts to leak because the kidney's like, wait, I wasn't supposed to be picking up ketones and glucose. I was just supposed to be picking up the fluid, right? All right, so another one is HHS. So DKA can happen in type 2 diabetes, but it mostly happens in type 1 diabetes, right? Okay, so HHS is the one that mainly happens in type 2 diabetes. So this happens with hyperglycemia, but without the breakdown of ketones, right? So there isn't acidosis going on or ketosis going on because there is just enough insulin present in the body to prevent the breakdowns of fats. So signs and symptoms, this patient will be very dehydrated. They will be very thirsty. And they could have some mental changes going on as well. So the difference between DKA and HHS is that there just isn't ketones present in HHS. Okay?